Hey, it's Dr. Bill with just the tip of urology school. This video is going to briefly address pain. And again, this is to serve just as to pique your interest. Remember to go to the AUA core curriculum on pain management. It's quite good. Remember, your experience and your judgment can always add more. So I want to hear from all of you who are listening to this and see what we can do to add to the list. When you get calls about pain, either when you're making rounds or seeing patients in our clinic, or more commonly when you're on call, you got to be specific. People are usually going to be somewhat emotional and agitated. Try to, one, understand their pain, and also try to glean as much information as you can. Things like, have you had this pain before? Can you describe it? Where is it? How intense it is? Is it sharp or dull? Have you experienced this pain before? What have you done to relieve the pain in the past? Are there any precipitating events? Anything that you do, whether it's physical activity or over-the-counter medications that have made it worse or have decreased the pain? Have you had recent surgeries? Always think of postoperative bleeding. Has there been recent trauma? Is it related to bladder spasm or bladder distension? Remember, these are vague complaints, and some people may just talk about abdominal or hip pain. What about pain from the urethra or a ureteral stent? In recent endoscopic evaluations that placed the stent for either colic or hydronephrosis, or as part of a previous surgery, or from trauma? Has patient undergone a laparoscopic procedure where phrenic nerve irritation is commonly seen by procedures to distend the peritoneal contents and the retroperitoneal contents intraoperatively? And of course, the worst case basis, is there an MI occurring? So when you look at this, try to be as specific as you can, and determine real quickly whether you believe you can handle it at bedside or need a hospitalist to intervene. Also, we are aware of the opioid crisis in the United States, but also understand there's certainly an appropriate place and time for opioid use. Sometimes over the phone, when it's an emergency call, you can't get a feel for what's going on. Rather than a knee-jerk response to provide pain meds, it's prudent to send the patient to the emergency room or urgent care center for a more in-depth evaluation, and obviously to make sure that the patient's safety comes first. It may be irritating to the patient and certainly inconvenient, but we have to think in terms of worst case basis and what we're trying to prevent. Dr. Bill with just the tip of urology school, talking about pain management.